about some things that you can do as owners to help us as veterinarians know what we need to know before you call in or bring your animal to the hospital. First of all, just notice the respiratory rate and do that before putting your hands on the animal. And you can do that by either watching the chest go in and out, or actually if they're breathing hard, you can use flaring nostrils and things like that. Those are all very good things to notice. You can see this animal's nostrils moving with respiration, but an animal in respiratory distress will have a much more pronounced flaring of the nostrils. The next big thing we want to do is heart rate, and you can take that a couple of different ways. If you do have a stethoscope, the easiest way to do it is just use your stethoscope and go with the bell. You can use the bell to go right behind the point of the elbow and hold it there and count how many beats are there in the 15-second period, and then multiply that by 4, and that'll give you beats per minute. And that's a good thing to report to the vet. Placing the stethoscope bell behind or underneath the elbow on the right or the left side should allow you to hear the heart and count the beats. If you do not have a stethoscope, you can often feel the heartbeats by placing your hands in the same area. Palpating or filling of the abdomen is a good way to know if it's very distended, much larger than it usually is, or very tight, or the animal is resistant, doesn't want you touching him there. That means it shows signs of pain or colicky type things. To note whether or not the animal has passed feces is also very important in assessing the GI tract. Take a rectal temperature. It's a good idea to have somebody restraining the head. If you don't have that available, you can just tie the animal with a halter to the tie ring, and then you just lift the tail standing to the side, insert the thermometer into the rectum, and push the button, wait for it to beep, and that'll tell you the rectal temperature. A digital thermometer with a fast readout is ideal for rectal temperature. The color of the mucous membranes is also an important assessment of the circulatory system. This assessment can be made by looking at the inside of the eyelid, the third eyelid, or the gums. Looking at the eye to look for color of the eye in the pink third eyelid, and you can see that by pulling the lower eyelid down. And as well as the color of the gums. And if you have a black animal, oftentimes the gums will be black, so you have to look in the eye. But you can see the nice pink color, and then when you press, it turns white, and you let go, it turns pink again. And that should happen within 2 to 3 seconds. That should turn back color. You can also look into their eyes with a flashlight. So you look for any opacities or anything floating around in there, and also if you're shining the light in the eye and the eye stays dilated, that's something very important to let us know as well. So you can also, it's very important to listen to see if the GI tract is moving like it's supposed to. And most importantly, we want to listen for contractions of C1. And C1 is going to be found on the left side, just behind the last rib. And you can do one of two things. If you have a stethoscope, it's nice to be able to listen just by placing the stethoscope bell on the side of her abdomen, right behind the last rib, and listen for 2 to 3 minutes for contractions. And you'll hear hear contractions rolling through that sounds kind of like thunder. If you don't have a stethoscope available, you can also just put your hand there and feel for rolling movements through that compartment.
This slide shows where C1 is located and where to place the stethoscope for proper assessment of C1 contractions. It is important to note whether or not the animal is passing urine and feces and the character of the feces produced. In summary, making a routine assessment of your animal can provide important information to your veterinarian that can help expedite the decision-making process for the health of your animal.